Hello. Today, I will be talking about the future of healthcare in the era of climate change and planetary health. And let me begin by showing to you this cartoon. You may have seen this on social media being circulated around during the COVID-19 pandemic. And, during those past 3 years, we've been always talking about waves of COVID-19 because of the variants that have been arising in many different parts of the world. But I think, and I strongly believe, that apart from being vigilant about future waves of COVID-19, we need to remember that the virus is still circulating amongst us. It will not disappear. We will need to learn how to live with it. There are also other, not just future waves, but as you can see in this cartoon, future tsunamis of climate change and biodiversity collapse, and all these ecological threats that are expected to harm, to jeopardize the health of human populations in the years to come. And one of which is climate change, which you already saw in the cartoon. I would just like to give a quick review on what climate change is and how it happens. And we know that the planet has what we call a natural greenhouse effect. But unfortunately, because of our many different activities, human activities, for instance, the burning of fossil fuels, we've been emitting enormous amounts of greenhouse gases and releasing them into the atmosphere in amounts that are beyond, the capacity of the atmosphere, the planet. And so what happens is that greenhouse effect, the natural greenhouse effect, becomes enhanced, intensified, as you can see in this diagram, human-enhanced greenhouse effect. And therefore, the heat that is coming from the sun entering the planet is being trapped inside planet Earth. And that leads to the further warming of the planet, further destabilization of the climate system, which then leads to a cascade of effects. And later on, I'll be showing these consequences, these impacts. I already mentioned that one of the sources of greenhouse gas emissions is the fossil fuel industry. And here in this a series of pie charts, you will see the different sources of greenhouse gas emissions, the different sectors that are emitting these noxious gases that harm the planet, harm the atmosphere. And you will see at the top pie chart that the biggest portion of greenhouse gas emissions is coming from the electricity sector, the energy sector. And then you will also see that there are other sectors contributing to the climate crisis, transportation, which also uses fossil fuels like petroleum and natural gas, our industrial process, our use of land, and the way we destroy our forests and turn them into farmlands in the pursuit of large-scale agriculture. That process destroys the carbon sinks that we have. And when we say a carbon sink, these are, the forests, for instance, that absorb carbon and other greenhouse gases from the atmosphere, which helps in climate stability. And then there are other sources or sectors contributing to greenhouse gas emissions, the way we dispose our waste, residential and commercial sources, among others. And it's also important to remember that when we talk about greenhouse gases, yes, the majority or the bulk of it is comprised of carbon dioxide, but we also have other greenhouse gases such as methane and nitrous oxide, which are coming largely also from agricultural production. So these are the sources, the sectors that we need to address, whose emissions need to be curbed if we want to stop climate change from worsening in the coming years and decades. But unfortunately, climate change is already happening. It has already begun to evolve and occur, and many different parts of the world are already experiencing the impacts of climate change. And this diagram summarizes to you the wide range of environmental or ecological changes that are anticipated, already happening, when climate change continues to exacerbate or be exacerbated. So, for example, changing rain and snow patterns, and less snow and ice. For example, in the Arctic and the Antarctic, we're also seeing the melting of the ice, which then leads to the rising of the sea level. But also your oceans are warming, and so that also contributes to not only coastal inundation or flooding, but also the destruction of coral reefs, which are the forests of the sea. That's where little fish and other sea creatures do reside and obtain their nutrients from. And so this can lead to major impacts, for example, in the fishery sector. And then we already are observing higher temperatures, more heat waves, more droughts and wildfires and bushfires, for example. And also animals and plants, their behavior, their growth patterns are also changing as well. So these are the wide array of ecosystem changes that are a result of the destabilization of the global climate system. And it's not only the environment, not only other living things that are being affected by climate change. Ultimately, it's human societies, it's our communities. And this illustration shows to you the wide range of social and economic impacts that, again, we are not just about to experience, we are already facing now. For example, relocation of entire communities, entire towns, again, because of coastal flooding, shrinking productivity of harvests. Many farmers around the world are already complaining about the decline in harvest. Also, water supply is dwindling in many parts of the world. Water, as we know, is so essential and vital for human survival. And workers also are exposed to either extreme heat or flooding or typhoons and cyclones, which then affects their capacity to work. Their productivity, labor productivity, is also being reduced as a result of climate-related effects. And so these are just some examples of the impacts. And at the bottom, you will see that, of course, even our diseases, the health issues that we are confronting today, will be also worsened as a result of higher temperatures and the many different impacts brought about by climate change. And this is what this next slide is showing to you. This diagram is coming from a 2015 article published in The Lancet. And what you're seeing now is that climate change and health have many different interconnections or linkages. You will see many arrows and many boxes, which just reflects the different pathways by which climate change influences or impacts human health. And on your right, you will see that there's really no single disease group that is going to be immune to the impacts of climate change. And you name it, and that health outcome is unfortunately going to be altered, modified, worsened by the climate crisis. And the next few slides will actually tell us more about these specific impacts. And I already said that every disease group is going to be impacted by climate change. Every organ system is also going to be affected by climate change, its many different effects and phenomena. And I would like to invite you to visit this website of the New England Journal of Medicine. This is a very interactive website. You can click on the organ system, and it will tell you how climate change affects that organ system, our cardiovascular system, our skin, the dermatologic system, our gastrointestinal organs, even our brains, neurological disease, mental health, among others. And so I think the message is that every health professional, every clinical specialty has a role to play in addressing climate change and protecting our patients and entire populations from the health impacts brought about by the climate crisis. Another important message about the links between climate and health is that while climate change is a universal issue, it affects all of us living on planet Earth, the health impacts are going to be unfairly distributed. And here you will see two maps. The top map shows to you the parts of the world that have emitted the greatest amount of greenhouse gases into the atmosphere. North America, Europe, and more recently, China. As we've seen over the past several years, China's rapid economic growth, which is very much reliant on the burning of fossil fuels. But at the bottom map, you will see the parts of the world that are bearing the brunt, that are suffering the consequences of climate change and its myriad health effects. The continent of Africa, huge swaths of Asia. The Pacific Islands here are too small to be magnified in the map, if not, unfortunately, totally erased from the face of the Earth as a result of sea level rise. And I think the core message here is that climate change, at the end of the day, is an issue of health equity and justice. What we want is to improve and protect the health of all people, but most especially giving special attention to those who are vulnerable, who are marginalized, the world's poor, those who are going to be disproportionately affected by the climate crisis in the coming years and decades. So now I'm showing to you the map of Southeast Asia. And Southeast Asia is as a whole, a climate hotspot. All countries in the region are going to be affected, are already being affected by climate change. But unfortunately, in this map, the redder the country is, the higher the vulnerability of that country is to climate change. And unfortunately, the Philippines is the reddest of them all. And so I guess what I'm trying to say here is that this is a very personal issue for me, and therefore I feel the responsibility and obligation as a physician, as a public health practitioner, to tackle climate change if I want and if we want to safeguard the health of our community, of our population, of our children and our children's children. So in the coming slides, I'm going to show to you how climate change affects health, population health, and health systems. And for example, in the Philippines, the most familiar impact to us is, the typhoons and the intense flooding that we experience many times within a year. On the average, we experience or encounter around 20 typhoons or cyclones each year. But over the past several years, we've been seeing its frequency and number increase, and the severity, the magnitude also worsening. And so this is a photo coming from the central part of the Philippines, which was destroyed by Typhoon Haiyan in 2013. It still remains to be the strongest typhoon to ever hit land in human history. And here you will see buildings, houses, farmlands, schools, even hospitals and health facilities, all destroyed by climate change, by extreme weather events like typhoons. And this has huge implications on, let's say, food security, water access, and of course, healthcare delivery as well. And over the past 3 years, we in the Philippines have witnessed firsthand the confluence between two crises. On one hand, you have the COVID crisis, and on the other hand, you have the climate crisis. And imagine you're a poor Filipino living along the coastlines or along the corridor of the typhoon, And you are confronted with a dilemma. On one hand, do I stay in the house to protect myself from the unseen coronavirus, only for the roof of my house to be blown away by the strong wind? Or on the other hand, do I move to these cramped evacuation centers, safe from climate-related disaster? But as you can see in this photo, there's no social distancing to begin with, and therefore there's a very high chance that you will be acquiring SARS-CoV-2 in these kinds of settings. So now I'm shifting gears, and a while ago we talked about typhoons and flooding, all the wet phenomena related to climate change. We also need to remember that climate change and the planet's health in general is essential to prevent infectious diseases, because many infectious diseases are sensitive to environmental conditions, to temperature, to humidity, among others. And for example, even the Ebola outbreak that happened in the early part of the last decade in Western Africa was also suspected to be related to climate change, among other factors. We need to remember that infectious diseases are, at the end of the day, multifactorial, but climate change is beginning to become a major driver threat multiplier of infectious diseases such as Ebola, but also dengue. Dengue is a mosquito-borne disease, and mosquitoes are very, very sensitive to changes in the environment. And now we are already observing that the geographic scope of dengue is expanding. You have countries, for example, in temperate regions in Europe that have never seen dengue for centuries, and now you are having a few dengue cases, which can increase more and more in the coming years as the climate continues to change, to warm up. And there's actually a very recent study that also revealed that climate change in itself, remember, infectious disease emergence is driven by multiple factors, but climate change in itself could spark the next pandemic. I'm sure you remember that COVID-19 is a zoonotic infection resulting from what we call a zoonotic spillover, when a pathogen, a virus, a microbe jumps from an animal to a human being. That can happen more and more if climate change continues to worsen, if climate change is not going to be averted. And as you can see, Southeast Asia, where the Philippines is located, is one of the major pandemic hotspots, infectious disease hotspots. And because it's also a climate hotspot, there's a very high chance that a future pandemic can erupt again if we do not stop climate change from worsening. So that's for infectious disease. Another major impact of climate change, which I already alluded to a while ago, is sea level rise, because of the melting of the ice, because of the warming of the ocean. And when the level of the sea continues to rise, the sea water begins to intrude into coastal areas, into freshwater systems. Unfortunately, in the Philippines, we are already witnessing some of the fastest rates of sea level rise in the world, 5 times that of the global average. And so this is another emerging public health threat that needs to be addressed, and we need to prepare for. And one of the impacts on health of sea level rise is health effects or health outcomes related to the intake of water that is high in salt content. So the salinization of fresh water resulting from the intrusion of the seawater into freshwater systems then leads to a wide array of health impacts. There's growing evidence that people who are consuming water that is high in salt in coastal areas acquire high blood pressure, preeclampsia, and gestational hypertension if you're a pregnant mother. The children, the infants are also being affected. Miscarriage is also increasing, and also kidney disease, among others. So this is a growing area of research, the links between salinity intake of water that is high in salt, and health. But also it's not just your water, becomes salinized. If climate change continues to worsen and the sea level continues to be much higher and higher, then entire communities can get forcibly displaced. And here you will see that even the capital city of Manila is also at risk of being underwater by 2050 if climate change is not going to be averted. And, as an archipelagic country, many of our main cities and towns are actually lying along the coastlines. And so this will have grave implications for human settlements, for population mobility, and eventually for public health. So now we'll move to the hot effects, or the hot and dry effects of climate change. And this is already something we're experiencing in the Philippines. Exposure to heat, intense heat. And we've seen in the past several months heat indices that are way beyond the usual here in our country. And as you can see in this series of maps, the entire Asia region is projected to become a much hotter and hotter region in the coming years. And therefore, it's very important that our communities, our cities, our public health systems are preparing for the health impacts of brought about by exposure to increasing heat-related illnesses like heat stroke, heat cramps, among others. And so how can we build urban heat resilience, for instance? And as you can see at the top headline, there are some cities in the world that have already been appointing chief heat officers. I'm sure you are aware of the chief executive officer, the CEO role in a business. Now we have a chief heat officer who is responsible for designing heat resilience plans, mechanisms, and systems. And air pollution is another impact that we need to be addressing. And air pollution is quite unique because it's not necessarily due to climate change, but the sources of air pollution are the same sources of the greenhouse gas emissions that I talked to you about a while ago. And so if we want to stop climate change and we want to stop air pollution, especially in cities, we need to address the sources, the factories, the fossil fuel plants, the burning of petroleum and coal, for example, for transport, because that, again, will help prevent climate change, but also reduce air pollution, which is good for our lungs, for our hearts, even for our brains. And here you will see that the World Health Organization estimates around 7 million deaths annually due to exposure from both outdoor and indoor air pollution. And so, again, if we want to protect our children, for example, from bad air, from dirty air, we need to address the sources. And I said a while ago, while climate change is not necessarily creating air pollution, the two issues are very much interrelated. And climate change can also make air pollution worse by changing the environmental conditions. The air pollutants tend to stay longer, for example, in the air, which then prolongs, our exposure to these noxious chemicals. And then another effect of climate change is decreasing food security or increasing food insecurity and undernutrition. And unfortunately, climate change is going to destroy our farmlands. I already mentioned a while ago, it's also going to affect our fishery sector, the productivity of our oceans and freshwater systems. And that can lead to the reversal of many of the nutritional gains that we have already achieved in the past several decades. These are numbers from the Philippines. And as you can see, we still have long-standing nutritional issues that need to be addressed. But climate change, unfortunately, is going to make the closing of these gaps much more difficult and challenging, again, because of what climate change is going to do to our farmlands, as you can see in this photo. And we need to start also looking at the food system if we want to address both climate change but also our nutritional challenges. There is a report in 2019 published in The Lancet, which described this confluence of problems as a global syndemic. When we say it's a syndemic, I'm sure you're familiar with the words epidemic and pandemic, but a syndemic is when multiple epidemics, health issues happen at the same time. They're all interacting with one another, and they're actually being driven by the same sources, causes, and drivers. So right now, we have a global syndemic of obesity. More than 2 billion people on Earth are either overweight or obese. Undernutrition, around 1 million people on Earth are not receiving the nutrients that they need for healthy lives. And the same food system is also creating climate change because of the emissions, because of the use of water and air and soil and energy. And our food systems are very much vulnerable as well to the climate crisis, which I already described to you a while ago. And so we need to address and transform our food systems if we want to address this endemic of obesity, undernutrition, climate change, and climate vulnerability of our food systems. And then finally, I already talked a lot about the physical health impacts of climate change. But we also need to remember that climate change is going to and is already impacting, influencing, affecting the health of our brains and our hearts. Climate change is a mental and emotional health issue. And in this diagram, you're seeing the many different pathways that connect climate change to mental health outcomes. We are more familiar with the impact of climate change on mental health through acute extreme weather events. So for example, when there's a typhoon or intense flooding and communities and families get forcibly displaced, then they are at risk of acquiring, for example, post-traumatic stress, which can last for a few months or can last for a lifetime. But there is also growing evidence that there are other mental health effects that are not necessarily related to disasters, to calamities, to extreme events. So, for example, when you are witnessing your homeland being destroyed by climate change, that leads to some feeling of sadness and sense of loss. And there's a term called solastalgia, which describes that emotional or psychological response or phenomenon. And another term that you may have already encountered is climate or eco-anxiety, which pertains to this constellation of feelings, but mainly, there's worry and fear and uncertainty towards and because of, climate change and the climate unstable future that we have. So, for example, there is a 10-country cross-sectional survey that was conducted and published in 2021, and it shows that among the 10 countries that have been surveyed, it's the young people from the Philippines that are the most climate anxious in the world. Around 90% of the respondents said that they are at least moderately to at most extremely anxious, worried about the climate, about climate change. So as you can see in the photo at the bottom, young people are fearing that, they'll be drowning inside their bedrooms anytime during the night because, again, of these, for example, the extreme weather events that they're already experiencing that lead to a prolonged feeling of worry and fear and uncertainty. So in the past several slides, I showed to you the health impacts of climate change, the physical impacts, the mental health impacts, the impacts on health systems. And unfortunately, this is the current pace of climate action worldwide. You will see that given the current policies and actions that our governments, the business sector, all segments of society are doing, we're actually on track to having a global average temperature increase of at least 2.5 to at most 2.9 degrees Celsius. But remember that in the Paris Agreement, which was signed by governments or passed by governments in 2015, we should be aiming for a maximum increase of 1.5 degrees Celsius, in terms of the global average temperature increase. And so we have a huge gap between our aspiration and what we're currently doing now. And so we need to accelerate the reduction of greenhouse gas emissions in order for us to move from that unsafe zone of 2.5 and bring it down to below 1.5, because beyond 1.5, catastrophic impacts are already expected, especially for the most vulnerable regions of the world. And unfortunately, also in a very recent report from the Intergovernmental Panel of Climate Change and the World Meteorological Organization, it was found out that we don't need to wait for 2030 for that 1.5 degrees Celsius threshold to be violated or breached. The expectation or the projection is by 2027, 3 years earlier than predicted, we will be reaching that threshold or violating the threshold. And so we really need to act soon, to act fast, because 2027 is only a few years from now. And we need the health sector to be doing its job, its role, to advocate for climate action, not tomorrow, but now. But unfortunately, the medical community is operating as if the global climate system is doing okay, as if there's no climate crisis. In fact, during the past 3 years, we have mounted a pandemic response that totally ignored the planet and instead created new forms of pollution, like the pollution of personal protective equipment or PPEs made of plastic that we're seeing around us. You can see plastic or medical commodities floating in our oceans and rivers and seas. And our health facilities are far from being prepared from climate change, as you can see in that picture of a health facility that is being inundated, that is underwater. And during the pandemic, we have seen that our health system is not ready for a pandemic. And it's likely that it's not ready for climate change as well, for the many impacts that I shared to you a while ago. And so the question that we should be answering now is, are we ready to build health systems that consider the climate? Are we ready to become health professionals that care not just for people, but also for the planet? Are we ready to reorient the global health sector to become more climate adaptive and resilient, but also not harming the planet? And so when we talk about climate action, there are two main actions that we need to pursue: mitigation on one hand and adaptation on the other. Mitigation pertains to actions that reduce emissions that cause climate change. I already showed to you the different sources of emissions a while ago. These are the sectors that we need to change in order to reduce greenhouse gases from being that is being released to the atmosphere. But we also need to adapt. We also need to prepare for and manage the risks of climate change impacts. I already described to you the many climate impacts on human health, and we need to prepare for those, and we need to expand our capacity to be able to address those challenges. And so when it comes to the health sector, the way to do mitigation and adaptation is by adopting what we call climate smart healthcare. Climate smart is a term that is at the convergence, or that describes the convergence between mitigation and adaptation, between sustainability and resilience. When we talk about mitigation and sustainability, we want healthcare to do no harm to the planet in the same way that we made a commitment to do no harm to our patients. We need to make sure that we reduce our emissions, our ecological footprint, our carbon footprint, our greenhouse gases being emitted. And then on the other hand, resilience or adaptation pertains to our level of readiness and responsiveness, even in the face of climate-related disaster. We need to make sure that health services continue to be provided, even when disasters strike. We want to make sure that our health systems are the last system standing, that we have a health system that bends without breaking. So how can we do both sustainability and resilience or climate smart healthcare within our healthcare sector, in our healthcare system? So in the next few slides, I'll be showing to you some of the things that we can do. So first, we need to identify the different sources of greenhouse gases within the healthcare system. And there are three main types or sources of greenhouse gases within an industry, a facility. First, the scope 1 sources pertain to emissions that are emitted on site. So for example, even our anesthetic gases and refrigerants are greenhouse gases that are emitted right there and then from the healthcare facility. Scope 2 emissions pertain to emissions coming from outside, from elsewhere, as a result of our consumption of energy. So for example, the emissions coming from the coal power plant that is providing us electricity through the electricity grid, that is a scope 2 emission, and that should also be counted in our emissions as well. And the final group is called scope 3 emissions. These are emissions coming from the supply chain, coming from the manufacturing and transport and distribution of the different materials, items that we use for healthcare delivery. So for example, the medicines and the devices that we purchase, or the waste that we dispose to the environment, the food that we serve to our patients and staff, all these are scope 3 emissions coming from, again, the supplies that we use. So the emissions happen elsewhere, but because we're consuming them, we also need to count them in our carbon accounting or measurement. And based on a report by the international NGO Healthcare Without Harm in 2019, it was found out that still the bulk of our carbon footprint or greenhouse gas emissions is coming from electricity use. And so we need to start implementing energy efficiency measures and also utilizing green renewable energy if we want to reduce that share of our emissions. And then other sources include, for example, the materials that we use in healthcare, even our floor cleaners, the food that we serve, the medicines that we provide. So all of these, again, are sources of carbon and greenhouse gases. In fact, in this report, it was estimated that around 5% of the global greenhouse gas emissions of the world are actually coming from the global health sector. So it's still a significant share. And if we want to be a role model for the other sectors, we need to address that 5%. So, for example, one of the frameworks that can be used, that can be easily used to guide actions within the healthcare system is this 10-point agenda or 10-pillar agenda of the Global Green and Healthy Hospitals campaign of Healthcare Without Harm. And so here you will see that there are 10 areas that need to be addressed. Leadership, there has to be buy-in from top leadership. We need to change the way we process and manage our chemicals, the way we produce and dispose of our waste, energy use, and also where we get our energy from, water management, the transport of our patients and staff, the food that we serve to our patients and staff as well, the medicines that we purchase, the building designs of our hospital and clinics, and also the way we purchase all the materials, the commodities that we use for healthcare delivery. Very easy to follow. And so I invite you to take a look at the website of the Global Green and Healthy Hospitals campaign. And so these are just some examples of hospitals here in the Philippines that are already embracing solar power. So we already talked about sustainability, mitigation, lowering the carbon footprint of the health sector. Now let's move on to how we can enhance the resilience of the health system to climate change. So this is a framework coming from the WHO on how to build climate resilient health systems. And basically what this framework is telling us is that what we want is that when a health system experiences a shock, like a typhoon, a cyclone, or a heat wave, or a stress, for example, food insecurity, or increase in infectious disease, what we want is that the health system does not collapse, but instead it recovers and recovers better than before, and even transforms to something much stronger and much more adaptive. And so the WHO developed some frameworks to guide national governments on how to build climate resilient health systems. For instance, there is this operational framework which uses the 6 building blocks of the health system framework as the foundation of this operational framework for climate resilient health systems. I will not belabor you with the details, but you can see the different building blocks. We need to make sure that, the way we finance our health system, the health workers that we produce, the services that we provide, they have to all be climate resilient. And we also need to enhance our ability to address disasters. We already talked about the extreme events, typhoons, flooding, cyclones, heat waves, bushfires, and we need to be able to, strengthen our ability to cover this entire disaster life cycle, and be better prepared, faster in response, but also faster in recovery and reconstruction. So these are just some pictures of our activities here in the Philippines, working with local health systems to enhance their resilience, their ability to address the impacts of climate change. And also, we need to start being familiar with climate data and be able to use climate data to make better decisions and plans within the healthcare system. So here you will see, a map of my hometown, in fact, here in the Philippines. And what we saw is that if climate change, especially flooding, continues to worsen in our hometown, a lot of the health facilities will be underwater. And so this means that, climate data can be used to inform decisions, for example, where to build our future hospitals, where to relocate our health facilities to, in order to ensure that healthcare delivery is not disrupted in the face of climate change. So this is another framework from the World Health Organization showing to you how we can build climate resilient and environmentally sustainable healthcare facilities. So we need to make sure that our healthcare facilities are not polluting and not destroying the planet, not creating environmental degradation. But also we need to make sure that our healthcare facilities can withstand climate-related disasters, shocks, and stresses. And that means making sure that there are equipped workforce people, there are water, sanitation, hygiene, healthcare, waste management systems, there's reliable energy, and the infrastructure, the devices are all both low carbon, but also resilient and resistant to climate impacts. And you may be wondering, okay, we can only do climate smart healthcare at the level of the health system or at the level of the health facility, but we can also bring climate action into the clinic, inside the clinic. And I would like to encourage all health professionals to learn more about climate and health, to learn about how every disease, group will be affected by climate change, and how can we better respond to these climate sensitive diseases or conditions, both in terms of diagnosis and management. And here in this slide, I'm giving you a sampling of all these different specialties: the OBGYNs, the gastroenterologists, the family physicians, the emergency physicians, the pharmacologists, all already beginning to consider climate change in their clinical work. And finally, it's very important that while we are addressing our own sector's issues, that while we are fixing our own backyard, we need to also work with the other sectors. Cross-sectoral action is vital to improve health and protect the climate, We need to work with our urban planners, the energy sector, the transport sector, the industry, the agriculture and forestry sectors, because all sectors are, one, emitting carbon and greenhouse gases, but also two, they need to also adapt to climate change. And so, we should not forget that the health sector is part of a community, a larger community of different sectors, and we cannot be working in silo anymore if we want to achieve our common goals of healthy people and a healthy planet. So I would like to conclude my presentation by reminding us all that climate change is a health emergency. It is an issue for us in public health, in the health professions. We cannot anymore turn a blind eye to this existential threat. And we must make sure that we incorporate climate change into our activities, into our practice, into our health policies, into the many different aspects of health and healthcare and public health work. And we need to also use the power of our voice, activism, advocacy. The health sector is a very powerful community. We've seen that during COVID-19. We know that the health professions or the health professionals are always deemed the most trusted professionals in society in many different countries. And we also need to remember that now we have not just one kind of patient, but two kinds of patients. On one hand, you have that kid wearing a face mask, trying to protect herself from the unseen coronavirus or from air pollution. But on the other hand, you have also Mother Earth wearing a face mask, not to be safeguarded from COVID-19, but instead to be safeguarded from the myriad ecological damages that we are inflicting on her as a result of our irresponsible human activities, behaviors, and decisions, which then in turn affects our health as well. And that's why I encourage all of you to embrace what we call the planetary health paradigm or approach. Again, in planetary health, we now have two patients, not just the people, but also the planet. Thank you very much.